kids and I currently work in parts of Lincolnshire. This video today is to talk to you a little bit about some top tips for equipment to potentially purchase to help with your post-SDR therapy at home. So there's three kind of essential pieces of equipment that we at PT Kids find are great for every child that's had SDR, and those are a therapy bench, a therapy mat and a peanut bowl. So we find that those three pieces of equipment are really useful for therapy at home. There's lots of other types of equipment on the market, so I thought it might be best to discuss those in relation to the GMFCS levels. So if your child is at a GMFCS level 1 or 2, the main kind of pieces of equipment that we would recommend are things like an exercise or Reebok step, a wobble cushion, a Bosu ball, which is like half of a gym ball, and also things like non-slip mats or spots that you can put on your floor so that you can practice stepping or jumping practice and things like that really. It's also worth thinking about the potential of a treadmill, which can also be really useful. For our children that are GMFCS levels 3, again, a treadmill is another really useful piece of kit. Now, when you're thinking about a treadmill, it's really important to get the right one for your child, and the things to really look out for are things like that it goes slow enough so that we can really practice that stepping pattern, and so we can do that nice and safely and get a good quality movement pattern there. It's also worth looking at like the handle height to make sure that your child can hold it safely and it can be adjusted, and maybe looking for something with an incline, because again that can work on calf strength and really build them up when they're practicing their stepping, which is really good. I think it's really worth mentioning as well that after SDR, one of the most important things to be looking at is increasing that distance and that amount of walking and that weight bearing. So any way that you can facilitate that is really good. So that's why treadmills can sometimes be a really kind of good piece of equipment to have in the home, just to help increase the amount of walking practice that you can get done in a day really. So that's just something else to consider. With your GMFCS level 3s as well, a leg press can be a good piece of equipment, because we can then work on our strengthening of our legs while we know the child is in a really good seated posture. So that can be another good bit of kit to use as well. It's also worth thinking about a pedometer, because again we've been talking about increasing that walking, and so that's a really great way for your child to kind of be able to keep track of their progress and how much walking they are doing. So that could either be a standard pedometer that would go around the wrist, or it could be a pedometer that attaches to the shoelace, which would be really useful for those children that are still using a walking frame who don't have their hands free. So that's another good piece of equipment to have. It's also worth mentioning, and probably one of the most important things for our GMFCS level 3 children is to have a pair of tripod sticks, because often with this level 3, we're trying to progress children from their walking frame onto some tripod sticks and then potentially onto elbow crutches or standard sticks, if that's something that we're working towards, dependent on the child. So a pair of tripod sticks is a really good piece of equipment for the level 3 children, to kind of really progress them and work on that progression. Moving on to GMFCS level 4 and up, it's really again about doing that supported standing and helping your child to increase that weight bearing status and strength. So a couple of pieces of equipment that we find useful are things like parallel bars or a ladder step, which the child can hold on to, and then they can really practice and work on their supported standing. Alongside this, a pair of leg gaiters is also really useful, just to help with that supported standing, and again just increasing that weight bearing, tolerance and strength really. So we find those things are really useful. There's also other things on the market which some families have integrated into their therapy. So that's things like an iJoy, which is essentially like a horse riding simulator, which you can use at home. So that's something that some families find really enjoyable. And also like vibration plates, they can be something else that children enjoy, and they can, they may help with things like bone density, blood flow, things like that. So that's another thing that some of our families do consider as a way of integrating more therapy into their daily routines. And also just to say about therapy trikes, so they're a really, really good piece of kit. Again, it's about trying to incorporate therapy into your daily life, making it as easy as possible. The more you do, the better. And so therapy trikes are really great for those level 3 and 4 and 5 children. It's just another way to really get them moving, work on that strength and coordination, and it's fun as well. So it's a really good way for parents to integrate therapy into daily routines, really. So that's a little bit about equipment and what may or may not be beneficial for you at home. If you have any other questions, please do contact us at office@ptkids.co.uk, and we'll be happy to help with any questions. I'm also currently working in the Lincolnshire area, and I'm available on Mondays and Tuesdays currently. So I'm again, happy to answer any questions, and we look forward to hearing from you soon. Okay, bye guys.